is Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton Beach. And I want to, I'm doing a series of videos on blood sugar and how it's affecting the body. And we talked about how dysglycemia has a strong effect on the body, and then in the next video we talked about actual inflammation and what that can do. So now we're going to start talking specifically about different organ systems. So one of the main things that the blood sugar can affect is actually your digestive tract. Now everybody knows that food is our digestion. Our digestive tract is how we break down our food and get the nutrients out for our body to use it. It's a critical process. What a lot of people don't know is that the digestive tract, or the gut, is actually responsible for somewhere between 60 and up to 90% of your serotonin production, your feel-good neurotransmitter. So if you have gut dysfunction, you can actually get into situations of depression. Also, the digestive tract in the gut is responsible for somewhere, between 40 and 70% of our immune function based on our gut bacteria. So that digestive malfunction is huge in the body. Now, one of the ways that this can be affected with blood sugar is when you eat too much blood sugar, it feeds the bacterial colonies in the body. And if you happen to have bad bacteria or a yeast overgrowth, feeding it with blood sugar, eating these high glycemic foods and feeding that will cause the situation to get worse. And that will cause a huge imbalance in the digestive tract, a huge imbalance in your body, and a huge imbalance in your immune system. So for example, if that overgrowth happens to be yeast, then you might end up with thrush or yeast infections or things along those lines. You may end up with skin issues because the body's trying to excrete these things out, and it comes up and affects the skin. Just a huge amount of effect. Another part that is really important is leaky gut syndrome. Now, leaky gut syndrome, what that is you have a bunch of cells in the intestines that butt up against each other. And these cells are actually the barrier that keeps things out of the body that shouldn't be in there. So I want you to imagine that your digestive tract is actually outside of your body. So when I take this bottle cap, or this pen cap, it's off this marker, there's nothing in this pen cap that my body's going to want to digest. If I swallow it, hydrochloric acid is going to hit it, digestive enzymes are going to hit it, all these different processes are going to hit it. It's not going to break down. Eventually I'm going to pass this out through my stool. So it's going to go through the digestive tract without getting into my system. Okay? That's a filtering system. It's a way to keep things out of the body that shouldn't be there. So technically this tube from the mouth to the anus is exterior to the body. It's keeping things out of the body. Well, if you have chronic inflammation, as we've talked about in the previous videos, that can lead to digestive inflammation as well. And these tight junctions, so you have these proteins coming down, they break down even further and further. Eventually they go out and they go into the bloodstream through the tight junctions. Well, if you have chronic inflammation, then what will happen is these tight junctions will become more pliable and open up, just like the blood-brain barrier that we talked about in the previous video with the inflammation. So when the tight junctions open up, these larger molecules can get in. These larger molecules should not be in the blood supply. So that causes an immune response, which eventually, if it continues on long enough, could lead to an autoimmune response. This is called leaky gut syndrome, or what we call intestinal hyperpermeability. And it's very common to see this in patients that are chronically ill, especially in, let's say, Hashimoto's patients who have autoimmune conditions, or rheumatoid arthritis, or Sjögren's, or any of these rheumatoid or these autoimmune conditions. It's very common to see a leaky gut syndrome, and quite often a big cause of that is blood sugar. So, increased or dysglycemia. If you don't know what that means, go back and watch the video. Dysglycemia causes chronic inflammation. If you don't understand how, go back and watch that video. That inflammation starts to break down tissue, and one of those breakdowns happens in the digestive tract, which has huge repercussions. So a lot of times patients will go and they'll start doing gut cleanses, start doing diets to try to cleanse the intestinal tract and everything, and that's not the issue. It is an issue, but it's not the cause. A lot of times the cause can be blood sugar or other things behind that. So you've got to get to the cause, and the only way you can do that is through proper functional analysis. Okay, so I hope this makes sense. In the next video, we're going to get into another organ system and show you how blood sugar can affect that. If you have any comments or questions, please feel free to post below. Also, if you have any ideas or anything that you'd like to learn more about, please feel free to post that below so I can get those videos shot as well. All right, see you on the next video.